Welcome back to Ronnie, I'm Joe B. Today I'll show you how I treated a patient with a C-curve scoliosis who had significant pain reduction and improved posture post-session. Let's dive in. A C-curve scoliosis is a lateral curvature of the spine that can occur at the thoracic and/or lumbar region. It is named based on where the convexity of the curve is. In the lumbar spine, if the convex or bulging side is on the left side due to right side bending and left vertebral rotation, it is called a levoscoliosis. If the convex or bulging side is on the right side due to left side bending and right vertebral rotation, it is called a dextroscoliosis. In the thoracic spine, if the convex or bulging side is on the right side due to left side bending and right vertebral rotation, it is called a dextroscoliosis. The right rib will move superiorly, posteriorly, and externally rotates. The left rib, on the other hand, will move inferiorly, anteriorly, and internally rotates. If the convex or bulging side is on the left side, due to right side bending and left vertebral rotation, it is called a levoscoliosis. The left rib here will move superiorly, posteriorly, and externally rotates. On the other hand, will move inferiorly, anteriorly, and internally rotates. The cause of this can be due to neuromuscular conditions, birth defects affecting the bone development, and spinal injuries. A C-curve scoliosis can bring about a localized dull aching pain on the mid to low back. You can also notice one side shoulder is higher as well as the opposite side hip. For instance, if you have a thoracic dextroscoliosis, then the right shoulder and the left hip will be higher. During forward bending tests, you will also notice one side of the back to be higher. The assessment for the presence of a C-curve scoliosis requires the patient to perform a forward bending test. Patient is in an erect, relaxed standing with arms at sides and base of support at 2 to 4 inches. The therapist will be behind the patient with eye level, preferably at the pelvis. The patient is instructed to bend forward as far as able while keeping the knee straight. The therapist observes the presence of a rib hump or elevated side of the back, indicating the convex side of the scoliotic curve. Normal findings are that both sides of the back and buttocks are level. Abnormal findings is that the right side of the back or buttock will be higher than the left side, indicating a C-curve dextroscoliosis. In standing, you also notice rib hump. For the treatment, let's say your patient has a dextroscoliosis, may it be on the lumbar or thoracic spine. Patient is in a quadruped position. The left hand is moved as far forward as able, while the left knee is moved as far backward as able. The position is held for 30 seconds, hold for 3 to 5 reps, 2 to 3 times a week for 1 to 3 months. So do you want to know how to prevent progression of an S-curve scoliosis? If so, then watch this next video. Thanks so much.